So the question is about the NAICS codes that are defined and whether or not the KBA invests in all of those. This is a great question in two ways. One is, to be clear, the companies that are identified in the NAICS codes are the clusters, the NAICS codes from which our income is derived. It stops right there, right there. To answer your question, we invest in 5 clusters. And again, animal health, bioenergy, things of that sort. So to be clear, no, we do not invest in all of those. But I think, again, we think that focus, that discipline, really is a key part of what we do. We do. I can more than we in fact, if it makes sense, I'll give it to Brian. We on an annual basis do what we call our outcomes report. We have someone from our office here. I want to say the average bioscience wage in Kansas is, well, last year was 69. This year is 74. And the total wage I can get to you, but we are for what it's worth, we're a public entity. Any data you want about how we operate, outcomes associated, any reports, tips and tricks to steal from Kansas, I'm more than happy to give you. But the outcomes report is required under our act, and what we track in the outcome, the metrics that are in that report are provided to the governor and the Kansas legislature, and we completed that report last week and presented it to our board on next Monday. So I'm more than happy to give it to you.
And we'll put on the WEDA website as well. No?
Question about the discussions that you may have with collaboration beyond your geopolitical boundaries and thinking of the Midwest as a large entity versus...
Yep. But that's one our board just approved, and there were lots of sort of raising of eyebrows for about maybe 20 or 30 seconds, and the point was, if they're the best at it, if that's where the company wants to go, if that's what's going to move the needle for this company in Kansas, we're going to fund it. I do believe a broader Midwest approach around the biosciences is certainly going to be essential, particularly in the venture capital realm. Again, we did the open house for MPM. MPM just moved into their big new building in Kansas City, Kansas yesterday. It was rather interesting, They spoke about, why are we here in the Midwest, but, what's really going to change the game? And what's going to change the game is when organizations like the KBA and others here in the greater Midwest start thinking about growing capital capacity and exposing, much like Heartland BioVentures does, exposing opportunities to those venture investors. That's when they're going to start getting off planes.
Sounds like the greatest success that you had is landing the federal lab.
Clearly.
Growing a number of relationships in that cluster. What would you say is your greatest disappointment and what did you learn?
Greatest disappointment was very early on. We got sucked into areas of investment that had almost no bearing on job creation or the expansion of our research infrastructure. And I'm not trying to be vague here. It was education, training, and workforce development. And I think that people quite simply thought that Commerce doesn't have the money for it, so let's go to the KBA. And I will tell you openly, we funded a number of those projects, and I think we regret every single one of them. I think what we were trying to do is to look for a model that was not just one-off, and they were all one-off. And it really didn't, now to be clear, we know we need, training, education, workforce development. We fundamentally need that. But there are at least 2 other state agencies in Kansas and interesting enough at the regional level, even more than that, that are substantially more impactful in that particular area than we are.
Other questions? Just one clarification. Kansas Technology Enterprise Corporation. Explain what they do and how you're different. And secondly, in your view, bioscience is very definitely similar to Kansas is focused in one part of the state. Can this model be translated to other industry sectors as long as the NAS codes are very well defined?
Yeah, so just first off, KTEC is one of the oldest technology-based economic development organizations. It was created in the mid-'70s, for what it's worth, it's still a very successful organization. It's funded through a combination of general revenue funds and lottery funds. Its mission is everything, more or less, all technology clusters except for bio. I think it also runs the state's MEP program, Manufacturing Extension Partnership Program. It manages the state's angel tax credits and several other programmatic areas. They do something we will not ever do. They fund other economic development organizations and support them. We fund projects. So they fund the incubators. They fund the regional organizations. Now, why do I say we don't do it? Well, we don't do it because they already do it. And that collaboration really matters a great deal to us. In terms of the extensibility of the model, absolutely. I mean, if you're going to do it in an industry cluster with enough heft. So bio would be one, healthcare IT. So what's missing from ours? I mean, a big, fast-growing area of our bioscience area is healthcare IT, diagnostics. None of that's up there. Do we feel shorted? No. When we're bringing in $35 million a year, hard to feel shorted. Energy would certainly be another one. I think there are large, big clusters. I think to answer your question, it's the careful definition of what that cluster is, understanding the dynamics, making sure there's a research strength there. If that research strength's not there, it's really hard to do this stuff. So I would encourage you to look for those ingredients.
Any last questions? If not, thank you, Tom.
Appreciate it. Thank you.